Hello. This is Sudharshan, and in this episode, PH 1.29, we will talk about drugs to treat congestive heart failure. So, what are the different drugs we can go with? So, we have, as per alphabetical order, we'll see. With A, there are no drugs. Okay. So, with B, we have two, that is beta blockers, and BNP, that is brain natriuretic peptide, and the drug in this class is nesiritide. And beta blockers, mainly the non-selective ones. And with C, we have cardiac glycosides, very commonly digoxin. Other drugs include digitalis, digitoxin, and oabin, O-U-A-B-A-I-N. And with D, we have diuretics. And apart from that, with N, we have neprilysin inhibitors. With P, we have phosphodiesterase 3 inhibitors. And neprilysin inhibitor is sacubitril, phosphodiesterase 3 inhibitors, that is amrinone or inamrinone and milrinone. And then we have the sympathomimetic amines. These are the amine drugs which will increase the sympathetic tone, like dopamine and dobutamine. Right, and then we have vasopressin receptor antagonists that are going to block ADH receptors. Tolvaptan and conivaptan, they are used to treat SIADH. And apart from that, the vasodilatators, like we have mainly this antihypertensive drugs mainly. Right, so here in this lesson, we will mainly focus on cardiac glycosides and phosphodiesterase 3 inhibitors. So starting with cardiac glycosides, we have digoxin. So mainly it is extracted from the digitalis purpurea, which is a plant. And the mechanism of action of digoxin, or I would say digitalis, it is going to block sodium potassium ATPase pump. This is important. Sodium potassium ATPase pump is blocked. So calcium entry will be there instead. And that increases the heart functioning. And what about the pharmacological actions and side effects? They are almost the same only. So cardiac and extracardiac. Cardiac with respect to heart, it causes arrhythmias where we see increased heart rate. And some important ECG changes. Mainly it causes SAN and AVN depression. And apart from that, it increases duration of action potential, effective refractory period, and QT interval. So that is why it causes torsades de points, or twisting of points. Right, and ECG changes, three very important changes to remember. One is depressed PR interval and depressed QT interval, depression of ST segment and inversion of T waves. So U wave is seen instead. And U wave is very commonly seen in hypokalemia. Extracardiac, other systems like gastrointestinal distress, kidney, it causes the failure, and with the CNS, neuropsychiatric symptoms. All right, and then with the uses, mainly it is used to treat congestive heart failure. Apart from that, other conditions like atrial fibrillation or flutter, and PSVT, that is paroxysmal supraventricular tachycardia, where there is increase in heart rate and involving above the ventricles. So sometimes even ventricular fibrillation also is seen. And the side effects I've already explained. With the pharmacokinetics, let us see. So very importantly, digoxin has a low therapeutic index. Toxic dose is more. So we have to adjust accordingly, especially for patients with kidney failure. And with the drug interactions, it will interact with bile resins like cholestyramine, the 3 C's. Cholestyramine, cholestyramine, and colsavilam. Also with the class 2 and class 4 antiarrhythmics, that is the beta blockers and calcium channel blockers. Then with the diuretics and with the other congestive heart failure drugs like sympathomimetic amines. Also maybe rarely it can interact with succinylcholine. Right, and when it comes to the digoxin toxicity, what are the different treatment options we can do? Mainly supportive care. So immediately the patient is shifted to ICU And then what are the different agents that can be given? So to control the arrhythmias, we can give lignocaine. Apart from that, we can give digibind and MgSO4. These are some of the drugs. And the last resort treatment of digoxin toxicity is cardiac pacer if the drugs fail. So that is, we will try to give shock and activate the heart function. Right. And apart from that, let us talk about another group of drugs, phosphodiesterase 3 inhibitors, that is amrinone and milrinone. So the mechanism of action is clear. They will block phosphodiesterase 3. That increases cyclic AMP and in turn protein kinase levels, and that will affect the cardiac output. And with respect to the uses, it is used in ventricular arrhythmias and hypertension. And with the side effects, it will be opposite, that is hypotension, and because of hypotension there will be vasodilatation, flushing, and apart from that sometimes reflex tachycardia. Rarely we can see GI distress and pancytopenia, especially reduced platelet count, that is thrombocytopenia, and hepatotoxicity. Most of the drugs are like that. So that is all with the drugs to treat congestive heart failure. So thank you so much. We'll see you in the next lesson.